Have you ever wondered what daily masturbation might be doing to your prostate? Maybe you've heard some wild claims about it being great or terrible for your health, and you're curious about what's actually true. Let's dive into the science and unpack what happens to your prostate when masturbation becomes a daily habit. I'm going to walk you through the effects good, bad, and everything in between based on what research tells us. Stick with me because some of this might surprise you. The prostate is a small gland about the size of a walnut, sitting just below your bladder and wrapping around the urethra, the tube that carries urine and semen out of your body. It's a key part of the male reproductive system, producing a fluid that makes up about 20–30% of semen. This fluid nourishes sperm and helps them survive their journey. Beyond reproduction, the prostate also affects how smoothly you urinate. Issues like an enlarged prostate, inflammation, or even prostate cancer can cause problems like weak urine flow, frequent trips to the bathroom, or discomfort. So, when we talk about daily masturbation, we're looking at how it might influence this gland's health, both now and in the long run. One of the biggest questions out there is whether masturbation can lower your risk of prostate cancer. You've probably heard this idea floating around, and there's some solid research to back it up. A large study from Harvard, published in European Urology in 2016, followed over 31 men for 18 years. They found that guys who ejaculated frequently 21 times a month or more had a 20–30% lower risk of prostate cancer compared to those who ejaculated just 4–7 times a month. That's a pretty big deal. The theory behind this is called the prostate stagnation hypothesis. Regular ejaculation might flush out harmful substances, like carcinogens or inflammatory compounds, that can build up in the prostate's fluid. It's like clearing out a pipe to keep it from getting clogged. Frequent ejaculation could also reduce tiny calcifications in the prostate, which some researchers think might contribute to cancer risk over time. Now, this study didn't separate masturbation from sexual intercourse. Both count as ejaculation, so we can't say for sure that solo sessions are the key. But if you're masturbating daily, you're easily hitting that 21 times a month mark, which could put you in the lower risk group. It's worth noting that the study focused on men in their 40s and 50s, so the protective effect might be more relevant as you age. Younger guys might still benefit, but the data is less clear for them. Another study from 2018 in the Journal of Sexual Medicine backed this up, showing a similar trend. Men who ejaculated more often had lower prostate cancer rates, especially after age 50. The takeaway? Daily masturbation might be doing your prostate a favor in the long term. Let's talk about hormones, because they're a big piece of the puzzle. Masturbation causes a temporary spike in testosterone, followed by a dip as your body resets. Some worry that frequent masturbation could mess with your hormone balance, but the evidence is murky. The real hormone to watch is dihydrotestosterone, DHT, a more potent form of testosterone that's heavily involved in prostate growth. High DHT levels are linked to benign prostatic hyperplasia, BPH, a condition where the prostate enlarges and squeezes the urethra, making urination tricky. About half of men over 50 deal with BPH, and it can be a real hassle. Think waking up multiple times at night to pee or struggling to empty your bladder. Could daily masturbation affect DHT? Some small studies suggest that ejaculation might slightly lower DHT levels in the prostate tissue temporarily, which could reduce irritation or overgrowth. But there's no clear evidence that daily masturbation ramps up DHT production enough to cause problems. Your body has a tight system for regulating hormones through feedback loops, so daily sessions aren't likely to throw things into chaos unless you've got an underlying issue, like a hormone disorder. If you're noticing symptoms like weak urine flow or frequent urination, don't jump to blaming masturbation. Check with a doctor to rule out BPH or other issues. Prostatitis is another condition to consider. It's when the prostate gets inflamed, often due to bacterial infections, stress, or tight pelvic muscles. It can cause pain when you pee, discomfort in your pelvic area, or even trouble with erections. Some urologists suggest that regular ejaculation might help ease prostatitis symptoms, The idea is that ejaculating clears out inflammatory compounds or bacteria from the prostate, reducing irritation. A 2014 study in the Journal of Sexual Medicine found that men with chronic prostatitis who ejaculated 3-4 times a week reported less pelvic pain and better urine flow compared to those who ejaculated less often. Daily masturbation could fit into this routine, acting like a natural way to keep things flowing. But there's a flip side. If you're going overboard, say, multiple sessions a day with intense techniques, you might irritate the prostate or pelvic floor muscles. Overstimulation can cause temporary soreness or even trigger prostatitis-like symptoms in some guys. It's all about balance. If you're keeping it to once a day and it feels comfortable, you're probably fine. But if you're noticing lingering discomfort or pain, especially in your pelvic area, it's time to ease up and talk to a urologist. They can check if something else, like an infection, is going on. Stress is another factor that ties into prostate health more than you might think. Chronic stress pumps out cortisol, a hormone that can increase inflammation, weaken your immune system, and mess with testosterone production. All of these can indirectly affect your prostate. High cortisol is linked to higher levels of inflammatory markers, which can irritate the prostate and contribute to conditions like BPH or prostatitis. Masturbation can help here. When you orgasm, your brain releases dopamine and oxytocin, which are like natural stress busters. A 2020 study in psychoneuroendocrinology found that orgasm, whether from masturbation or sex, lowered cortisol levels by about 15% for an hour afterward, creating a window of calm. If you're masturbating daily, you might be giving your body a regular stress reset, which could keep inflammation in check and indirectly support your prostate. But here's the catch. If masturbation becomes compulsive or tied to anxiety, like using it to cope with stress multiple times a day, it could backfire. Compulsive behavior might actually spike cortisol over time, canceling out the relaxation benefits. The key is to keep it as a healthy part of your routine, not an obsession. If you're using it to unwind once a day, that's likely a net positive for both your mind and your prostate. Your pelvic floor muscles are another important piece of this puzzle. These muscles support your bladder, prostate, and rectum, and they're crucial for urinary and sexual function. Every time you orgasm, these muscles contract, giving them a light workout. In moderation, this can keep the pelvic floor toned and improve blood flow to the prostate. Good blood flow is huge. It brings oxygen and nutrients to the gland while clearing out waste. A 2018 study in urology found that men with stronger pelvic floor muscles had lower rates of BPH and better urinary control. Daily masturbation could contribute to this by keeping those muscles active. But just like with prostatitis, overdoing it might strain the pelvic floor. Think of it like any muscle group. Moderate exercise is great, but too much can lead to soreness or fatigue. If you're going once a day, you're probably in the sweet spot. To boost pelvic floor health even more, try adding Kegel exercises. These involve contracting and relaxing the muscles you'd use to stop peeing midstream. Do 10-15 reps a few times a day, and you'll likely notice better control and comfort over time. Let's address a common concern. Does daily masturbation deplete you or harm your prostate in some way? You've probably heard myths about it, causing weakness or infertility. The science doesn't back this up. Sperm production is a continuous process. Your body makes millions of sperm daily, and ejaculation doesn't run out your supply. A 2015 study in fertility and sterility found no significant drop in sperm count or quality in men who ejaculated daily for 2 weeks. As for energy, masturbation burns about as many calories as a short walk, so it's not draining your vitality in any meaningful way. That said, some guys report feeling tired or foggy after frequent masturbation. This is more likely tied to psychological factors like guilt, anxiety, or disrupted sleep if you're staying up late than to the act itself. If you're feeling off, check your overall lifestyle. Are you sleeping enough, eating well, managing stress? These have a bigger impact on your energy than daily masturbation. Another angle to consider is blood flow. Regular ejaculation increases blood flow to the pelvic area, which can support prostate health by keeping the tissue oxygenated. Poor blood flow is linked to conditions like erectile dysfunction and even BPH, so keeping things active down there might help. A 2017 study in andrology found that men who ejaculated regularly had better vascular health in the pelvic region, which could translate to a healthier prostate over time. What about the psychological side? For many, masturbation is a healthy way to explore their body and feel good. It can boost mood and self-confidence, which indirectly supports overall health. But if it's causing guilt or interfering with your relationships or responsibilities, that's a sign to reassess. Daily masturbation is fine for most, but if it feels like it's taking over your life, consider talking to a therapist to explore underlying triggers. Now, let's talk about age, because prostate health changes over time. For younger guys, say, under 40, the prostate is usually less of a concern. Daily masturbation is unlikely to cause problems and might even set you up for better prostate health later by keeping things active. For men over 40, the prostate starts to become more vulnerable to issues like BPH or cancer. Here, the potential protective effects of frequent ejaculation become more relevant. But as you age, you'll also want to keep an eye on symptoms like difficulty urinating or pelvic pain, as these could signal issues that need medical attention, regardless of your masturbation habits. Diet and lifestyle play a role too. A diet high in processed foods, sugar, or unhealthy fats can increase inflammation and worsen prostate health. On the flip side, foods rich in antioxidants like tomatoes, berries, or nuts can support the prostate by reducing oxidative stress. Exercise, especially activities that boost circulation like walking or yoga, also helps. Daily masturbation might be one piece of the puzzle, but it's not a cure-all. Combining it with a healthy lifestyle gives your prostate the best shot at staying in good shape. Let's touch on some practical tips. If you're masturbating daily, keep things gentle to avoid irritation. Using a lubricant can reduce friction and prevent discomfort in the pelvic area. Stay hydrated, as dehydration can affect semen quality and urinary health. And listen to your body if you feel sore or notice changes like pain during urination. Don't ignore it. These could be signs of an infection, prostatitis, or something else that needs a doctor's attention. What about the myths around masturbation causing prostate cancer? This idea stems from older cultural beliefs, not science. No credible study has linked masturbation to causing prostate cancer. In fact, the data leans the other way, suggesting it might lower risk. If you're worried about cancer, focus on proven risk factors like family history, obesity, or smoking, and talk to your doctor about screening, especially if you're over 50. Another question that comes up is whether daily masturbation affects fertility. For most guys, the answer is no. Your body produces sperm constantly, and daily ejaculation doesn't deplete your reserves in a way that impacts fertility. If you're trying to conceive, some doctors suggest spacing out ejaculation to every 2-3 days to maximize sperm concentration, but even then, daily masturbation isn't likely to cause issues unless you have an underlying fertility problem. Let's address the too much of a good thing concern. While daily masturbation is generally safe, going way beyond that, like multiple times a day, every day could lead to physical or mental strain. Physically, it might cause irritation or soreness in the prostate or pelvic floor. Mentally, it could signal compulsive behavior, especially if it's interfering with your work, relationships, or sleep. If you're in this boat, try cutting back to once a day or every other day and see how you feel. A counselor or therapist can help if it feels hard to dial back. On the flip side, some guys find that daily masturbation helps with sexual performance. Regular ejaculation can improve erection quality by keeping blood flow active and reducing performance anxiety. A 2019 study in Sexual Medicine Reviews found that men who ejaculated regularly reported better erectile function over time, possibly because of improved vascular health in the pelvic area. So, if daily sessions are helping you feel more confident in the bedroom, that's another potential perk. What about the role of porn? Since daily masturbation often involves pornography, it's worth mentioning. Porn itself doesn't directly affect your prostate, but excessive use can lead to unrealistic expectations or desensitization, which might impact your sexual health or relationships. If you're using porn daily, make sure it's not replacing real-world connections or causing stress. Moderation applies here too. Variety in your habits, like occasionally skipping porn, can keep things balanced. Let's circle back to prostate cancer for a moment, because it's a big concern for many. The Harvard study we mentioned earlier isn't the only one. A 2021 meta-analysis in urologic oncology combined data from multiple studies and found a consistent link between higher ejaculation frequency and lower prostate cancer risk. The effect was strongest in men who ejaculated 20-30 times a month, which aligns with daily or near-daily habits. But the researchers emphasized that ejaculation is just one factor. Genetics, diet, and lifestyle all play bigger roles. So, while daily masturbation might help, it's not a magic shield. Regular checkups, especially PSA tests after age 50, are still crucial. For guys dealing with BPH, daily masturbation might offer some relief. By keeping the prostate active, you could reduce fluid buildup or inflammation that worsens symptoms. A small 2016 study in BJU International found that men with BPH who ejaculated regularly reported less discomfort and better urinary flow over 6 months. But if your symptoms are severe, like struggling to pee or constant urgency, masturbation alone won't fix it. Medications, lifestyle changes, or even surgery might be needed, so don't skip the doctor visit. What about younger guys? If you're in your 20s or 30s, your prostate is probably in great shape, and daily masturbation is unlikely to cause harm. It might even help by keeping your pelvic floor strong and reducing stress. The key is to avoid aggressive techniques that could irritate the area. Gentle, mindful sessions are your best bet. If you're noticing any weird symptoms like pain or changes in urination, don't assume it's normal, even if you're young. Prostate issues can happen at any age, though they're rarer in younger men. Let's talk about hydration again, because it's super important. Dehydration can concentrate your urine, which might irritate the prostate or bladder. Drinking enough water, aim for 8-10 glasses a day, supports overall urinary health and keeps your prostate's fluid production running smoothly. Pair that with daily masturbation, and you're giving your system a good chance to stay clear and healthy. Sleep is another factor. If you're masturbating late at night, it might cut into your sleep time, and poor sleep is linked to higher inflammation and worse prostate health. A 2020 study in prostate found that men who slept less than 6 hours a night had higher PSA levels, a marker of prostate issues. Try to keep your routine earlier in the day or evening to protect your sleep schedule. Exercise ties into this too. Regular movement, especially exercises that boost pelvic circulation, like walking, swimming, or yoga, can enhance the benefits of daily masturbation. A 2019 study in the Journal of Urology found that men who exercised moderately, about 150 minutes a week, had lower rates of BPH and better prostate health overall. Combining daily masturbation with an active lifestyle could amplify the positive effects on your prostate. What about supplements or foods that support prostate health? While masturbation is one piece of the puzzle, nutrients like zinc and selenium are crucial for the prostate. Zinc is found in the prostate fluid, and low levels are linked to higher BPH risk. Foods like pumpkin seeds, oysters, or lean meats can boost your zinc intake. Selenium, found in Brazil, nuts, or fish, has antioxidant properties that might lower cancer risk. A 2018 review in Nutrients found that men with higher selenium intake had a 15-20% lower risk of prostate cancer. You don't need to overhaul your diet, just add a handful of nuts or a serving of fish a week to complement your routine. Let's address the cultural stigma around masturbation, because it can affect how you feel about your habits. In many cultures, masturbation is still seen as taboo or harmful, which can lead to guilt or anxiety. These emotions can raise cortisol, which, as we've discussed, isn't great for your prostate. The science is clear. Masturbation, especially daily, is a normal and often healthy part of life for most men. Letting go of guilt can actually make it more beneficial by keeping stress low. If you're wondering about the long-term effects, here's the deal. Most studies suggest that daily masturbation is safe and potentially beneficial for prostate health, especially as you age. But it's not a one-size-fits-all answer. Every guy's body is different. Factors like genetics, lifestyle, and existing health conditions play a huge role. If you have a family history of prostate cancer or BPH, daily masturbation might be one tool in your toolbox, but regular checkups are non-negotiable. Let's talk about when to see a doctor. If you're noticing symptoms like pain during urination, blood in your urine or semen, difficulty getting or keeping an erection, or pelvic discomfort that doesn't go away, don't wait. These could be signs of prostatitis, BPH, or something more serious. Daily masturbation might help with prevention, but it's not a cure for existing problems. A urologist can run tests like a PSA blood test, a digital rectal exam, or an ultrasound to get a clear picture of what's going on. For older guys, especially over 50, regular prostate screenings are critical. The American Urological Association recommends starting PSA tests at age 50 for most men, or earlier if you have risk factors like a family history of prostate cancer. Daily masturbation might lower your risk, but it's not a substitute for medical care. Think of it as a bonus, not the main strategy. What about the role of lube? Using a water-based or silicone-based lubricant can make masturbation more comfortable and reduce the risk of irritation to the penis or pelvic area. Avoid harsh soaps or chemicals that could cause inflammation. Keeping things gentle and clean is the way to go. Let's wrap up with some practical advice. If you're masturbating daily, make it part of a balanced routine. Pair it with a healthy diet, regular exercise, and good sleep. Stay hydrated and consider adding prostate-friendly foods like tomatoes, rich in lycopene, or green tea packed with antioxidants. If you're using porn, keep it moderate to avoid desensitization or unrealistic expectations. And most importantly, listen to your body. If daily feels good and doesn't interfere with your life, you're likely on the right track. If it feels excessive or causes discomfort, scale back and check in with yourself. Daily masturbation is likely safe and might even benefit your prostate by reducing cancer risk, easing prostatitis symptoms, and supporting pelvic health. But it's not a magic fix, and overdoing it could cause irritation or other issues. Combine it with a healthy lifestyle, stay mindful of your body's signals, and don't skip regular checkups. Your prostate will thank you for keeping it in check. Thanks for sticking with me through all this. If you're serious about your prostate health, small habits like daily masturbation paired with good diet and exercise can make a difference over time. Keep learning, keep listening to your body, and here's to staying healthy.